Good afternoon, everyone. Thank you for coming to the Parkinson's Support Group of Sonoma County's speaker presentation, our monthly presentation. This month's speaker, Dr. Traci Scherdell, specializes in adult neuropsychological assessment and rehabilitation interventions. She received her doctoral degree from the Chicago School of Professional Psychology and completed her pre-doctoral internship in rehabilitation psychology at the Jackson Memorial Hospital, University of Miami. She completed her 2-year postdoctoral fellowship in neuropsychology at the Baltimore Veterans Medical Center. Dr. Scherdell has been working in both inpatient hospital and outpatient clinic settings for most of her career and seeing patients across acute, subacute, and chronic phases of recovery. More recently, she has been on staff at the Northern California Veterans Hospital System, as well as Laguna Honda Hospital. In addition to her training for marathons, Dr. Scherdell is passionate about providing a holistic approach to cognitive rehabilitation with individuals who have neurological conditions. Thank you very much for joining us today, Dr. Scherdell. We look forward to your presentation.
I am very happy to be here, and yes, the title is the Adapting to Cognitive Changes and Use of Compensatory Strategies in Parkinson's Disease. And I just want to say that I really thank you to the support group. I have appreciation for your commitment to education and support, especially throughout the pandemic, adapting to this virtual format as needed, and just being there during this time is really important. I also want to acknowledge Dr. Diana Partovi. She has helped connect me with this group, and she's helped share some of her slides from a prior presentation. So I just want to acknowledge that as well. Today, I would like to just give us a little bit more of a sense of what is this thing called neuropsychology, what is cognitive rehabilitation, how do these things have a role in Parkinson's disease and helping to treat people with Parkinson's disease, and what are some cognitive changes and examples of cognitive strategies that might be helpful as we notice some of the cognitive changes that can happen with Parkinson's disease. Also touching upon emotional adjustments, adapting to these changes over time. And I get asked a lot of questions about technology, use of technology with helping to work around cognitive changes. And so I will try to touch on that as well, and just towards the end if we have time. So to start, what is neuropsychological testing? Neuropsychological testing helps us to get a better understanding of where the cognitive changes or breakdown may be. It helps us to find ways to adapt around the changes. And so testing includes a thorough clinical interview to get to know each individual and what they see or don't see as part of their problem areas, trying to get a holistic view and understanding of the individual and their support system. Each person brings to a testing session with a neuropsychologist. They bring their own biology, their own brain health, history of past and current life experiences. And the neuropsychologist tries to keep in mind that testing may not capture all of these things, but a skilled clinician will do their best to try to keep everything in mind. And so what is actually the testing, right? So I mentioned testing and how does it play a role? Well, there might be some changes in the earlier stages, some of these non-motor and motor changes that folks notice who have Parkinson's. The non-motor cognitive changes are thinking skill changes. And so these can be in areas, multiple domains affected by thinking. So attention, learning and memory, language, visual spatial processing, it's how we process visual information. Executive functions are how we help organize information, sequence, problem solve, and processing speed, how fast we process information. And so these multiple areas of thinking are where the neuropsychologist is giving tests and trying to see if there have been changes. And sometimes folks have been referred from their neurologist. Sometimes it may be part of their rehabilitation team. Maybe they've been through rehabilitation hospitalization in the past. Maybe they're going through a research trial, for example, with deep brain stimulation, and they've been referred to get some assessment before and after, maybe even before medication is tried or after medication is tried. So that's why somebody might go through these tests. And it's just an opportunity to sort of get an idea of a snapshot of where we're at a certain given time with our thinking skills and emotional functioning, life stress happening at that time, which can all impact these different areas of functioning, and then tracking over time. So hopefully, if there is anything that's detected, then retesting can look to see if any treatments have helped, or maybe we're maintaining function over time, just looking for changes over time. And the testing itself can take sometimes 2 to 3 hours if it's more comprehensive, and sometimes it's more of a brief screening over time. That'd be, less time. But the neuropsychologist will work with the rest of your treatment team to evaluate mood, look for other factors that might be impacting your thinking, such as sleep disorders, insomnia, REM sleep behavior disorder, sleep apnea, hearing loss, any deficiencies in your blood lab work, making sure that your B12 levels and other things that could impact thinking and memory are where they should be. And just like I said, keeping these things in mind, the whole person in mind, and trying to get a sense of the course and the timeline. And with Parkinson's disease, for example, like we may see some of those mild cognitive changes in the beginning, perhaps some more moderate changes as the disease progresses, and it can progress to dementia, where we have more problems with memory and daily functioning. But we would not expect to see a very sudden acute change attributed to the Parkinson's disease itself. And what do I mean by that? Just like from a day to day or within a matter of, hours to days, something going from being able to do something and then just immediately not, that we wouldn't expect to see. And you'd want to look for other signs like infection or medication changes, something else that's happening that would cause that really rapid acute change. And maybe there was a fall and we hit our head and there's a brain bleed. So we just want to keep those things in mind. Neuropsychologists will be able to sift through that information when they do the testing and work with you to kind of see, okay, does this fit with what we might expect to see with Parkinson's disease, and what maybe doesn't fit. All right. And so with this, a lot of times the testing gives a direction to go in. So it might help give a little feedback to not only the person who's getting the testing done and their family or support system, but the providers who have referred want to get a sense of where the strengths and weaknesses are with cognition, these thinking skills, and what to do about that. And so neuropsychological assessment usually gives us a bit of a roadmap, some recommendations for what are the strengths and weaknesses, and maybe how to start using some of the strengths to work around the weaknesses. Maybe also has recommendations for ways to improve mood, some of the other factors that might be impacting thinking, like sleep, like we talked about. So cognitive rehabilitation is one of these tools that the neuropsychologist may recommend, or others in the team may recommend, to help work around some of the cognitive weaknesses. So for example, it might be working to find just a way to maybe we're losing our keys a lot, and that's really frustrating. And family notices that's really frustrating. So developing some strategies so that is not happening as much. And just forming connections to work around the weaknesses too. So the more we practice something, the more we try to make it more routine, the better we may be at being able to just more automatically use it, and then hopefully not get us frustrated with some of the cognitive difficulties. So we talked about cognitive rehabilitation being more of a compensatory strategy, a way to work around and manage the cognitive challenges. So it's usually very practical and goal focused. And it might not just be about, hey, building skill. What about maintaining? Finding something that works and trying to stick with it. If that calendar system works for you, let's try to stick with it and or simplify it so that it can be something you use over time and can be easier for you to use. And it often includes collaboration with a treatment team. So some folks might have a neurologist, a physical therapist, a speech therapist, an occupational therapist on board. So there can be that collaboration in working towards shared goals to help with functioning overall and day-to-day quality of life. And it's also really important to note that, we're treating the whole person. So that includes the emotional reactions to the disease process, changes over time, any injuries or other illnesses that come in that come into the picture. And so that is something that's also important to keep in mind, that these changes over time are expected, and there's always ongoing adjustment. So cognitive rehabilitation can be, as I mentioned, in the acute stage of when somebody maybe was just diagnosed, or they had a fall or an injury, something has happened, and there's an immediate change. So that can happen with folks who've had stroke, brain injuries, and other disease processes. But cognitive rehabilitation can also be helpful beyond that acute stage. And so we often see it in outpatient settings where you're tapping into just learning some of these interventions and strategies to help maintain some functioning over time. And it might include care partners, family. It often does, especially in the case of mild cognitive impairment, where we're noticing some of those beginning stages of thinking changes, but maybe not as much of the functional change, and also early dementia, if that's on board. So I gave a little bit about what cognitive rehabilitation is. There's also a lot in the media that might confuse us with, well, there are things that also claim to help us to train our brain or to get our thinking skills to just drastically improve with little effort. And I just want to give us a sense that cognitive rehabilitation is not this kind of quick fix of going to the brain gym or using some games or apps that just want us to kind of do the same game, do the same thing over and over again, and not really have much human involvement or collaboration. And so, for some of these brain training things that have been advertised in the media, research is still needed on quite a bit about what is it that they're truly targeting, and what are the claims, are their claims supported? And so we just want to keep that in mind, that I would just avoid doing tasks or games just to do them, right? Especially if you're also not engaging with a professional. If you enjoy them, that's okay, and that's something separate. But to do them with the goal of like forming new neural circuitry when maybe that's not supported by the research is important to kind of take a step back and think about that. And so that puzzles and games, they can be fun. Even just the ones that are non-computer based, those are also really fun. So keep doing them if you enjoy that. But I would just caution against just doing them alone to try to change our thinking skills and our neuronal connections. So just a word of caution there. So I use the word cognitive in multiple areas of thinking already, and I just want to break them down a little bit more here. What are some of the areas of thinking that either a neuropsychologist, a neurologist, a cognitive rehabilitation provider would really want to try to assess and focus in on? And here we're talking about attention and complex attention. So basic attention, kind of how you are able to listen and hear, visually attend to something that's right there. Complex meaning, how do we hold that information in and maybe do something with it? So maybe a mental calculation, or hearing something and then trying to remember, oh, I have to put that into my calendar. So how do we manipulate that little bit of information that we're trying to attend to? Executive functioning is definitely something that affects folks with Parkinson's disease and other disease processes, but it's often the one we see earlier on, and it's the hardest hit due to just how many factors can impact it. So if we have stress going on, if we have a lot of just multiple things that we're trying to do at once, and you know, being able to meet the demands of, say, just trying to focus in on some of the changes, like safer walking while trying to navigate somewhere else, that's more demand on the brain. And so these things can be impacted. The more demand we put on the brain, it might get a little bit harder and we might feel a bit overwhelmed or overloaded. So that kind of ties into executive functioning with organization and sequencing and problem solving as well. We also mentioned processing speed, as how fast we're taking in information and processing it. Could be visually, could be from an auditory perspective. It could be just also sometimes reaction speed, how fast we react. Memory is something we'll break down just a little bit more, but that includes kind of the learning and memory process, the storage, and how we retrieve information. And language, how we process language, word finding, how fluent we are, maybe noticing just it's harder to get the exact thoughts into words. So those are kind of some language changes. And then visual spatial. So what do I mean by that? So how do I get a sense of, yes, myself in space? How am I navigating around in space? Am I seeing everything correctly, processing that information correctly? Am I missing some aspects? And has that potentially changed over time as well? So those are majority of the areas that testing, neuropsychological testing would target, and then also cognitive rehabilitation, and also just thinking about what might come up when you talk with your doctors about some of the thinking changes that have been noticed. And you know, some people with Parkinson's disease may experience difficulties in one area or more cognitive domains. And just like these physical symptoms, they do vary widely from person to person. Picking out the domains, the areas to focus in on, and working on one area may also help when we focus on another area. So you'll see in a little bit some of the strategies in one area, actually, like attention, for example, might overlap with some of the strategies we might use for memory or executive functioning. And just a brief overview. I don't want to spend a great deal of time on this because I think so many other presenters you have done a great job of talking about the motor and non-motor changes that can happen with Parkinson's disease, and where that, how that the brain is impacted. And so just a kind of review here, that there is changes to the basal ganglia in that system in the brain, the pathways that contribute to these changes that we're seeing. And the timing of onset might be different between noticing motor changes versus the non-motor, more memory, cognitive, sleep, mood changes that can happen. Also, we have pain, changes in dysarthria, maybe trouble swallowing, hypophonia, those things that happen with how we produce and talk. And so speech, talking, all those things that can also be affected. These are the more of the non-motor changes, and they're part of the symptom and the symptom pathway as well. So that neurochemistry that's changed with the basal ganglia changes and the dopamine that happens in the brain also affects other parts of the brain, and the pathways are all connected. And so that's another reason why several areas of thinking can be impacted. And the good news is that there are things you can do not only to gain awareness of sort of what's happening and maybe how to label it a little bit, but just how to work around it. What are some of the strategies to help compensate? Not necessarily to cure, but to say, hey, I recognize this is an area of difficulty. I'm going to try some things and see if they stick. And so getting a little bit more into the specifics here, when we're talking about attention and concentration, what are some of these things that people might notice? Perhaps it's harder to keep focus on something for a long period of time. That's sustaining our attention for a longer period of time. It might mean that before you could, sit and listen to a show or, be present at a sort of a presentation for maybe 40 to 50 minutes, but now it's much harder because you get tired more easily. And so the attention and concentration is one of those things where it just might be harder to focus and attend for longer periods of time. Some people describe feeling foggy, like there's a brain fog happening, and it's just harder to kind of get the mental energy to be able to shore up attention. And it might also show up in being more distractible. So, trying to focus on something, but then there's constantly noise in the background that pulls you somewhere else. Or it's hard if there's background conversation, even though it might be far away, it might pull at your attention. So those can be also some changes noticed. And why might this be happening? There can be many things that impact our attention. Sometimes medications can be sedating, especially if we're looking at some sleep medications, poor sleep itself, and just your brain might be pulled in so many different directions, and it might pull at your attention at any given point in time. What can we do if we're noticing some of these attention and concentration difficulties? Well, some recommendations are to try to take frequent breaks. Gaining awareness of where you're kind of getting overloaded or fatigued, getting tired, maybe taking more frequent breaks. Maybe there needs to be a break that's every 10 minutes or 15 minutes versus waiting for a half hour or 40 minutes. Stretching, walking around, moving the body a little bit also can help, not only just with some movement and blood flow, which we know can also help with attention, but it just changing context a little bit. That context can give us a little bit of a break to then be able to come back and try to refocus. And that's kind of the key here, is noticing when attention isn't working for us and trying to bring it back. This is where care partners, family members, friends can help if they can gently redirect us back. And trying to do things that are the most demanding, that we know are going to take the most mental energy, try to do those when you're at your best. So for some people, that's earlier in the day. For some people, that's after a nap in the afternoon. Just kind of knowing when you have the most energy to give, and trying to prioritize the hardest things then, because you will be at your best. And then distractions. We're in a world full of distractions, especially now with smartphones and technology. all around us. There's multiple ways that our attention can be pulled. And so maybe if you want to focus on something, just trying to reduce those things in the environment to start, turning off the TV, putting the phone aside, facing the person you're talking to, trying to just eliminate those things that you kind of know tend to distract you or others have noticed. And in the end, a lot of folks say too, I just want to be able to remember a little bit more about what I read or what I was watching on the TV or that talk that I went to. And a good way to do that is to take breaks, but then to summarize a little bit in your own words or just in conversation to talk a little bit about what it is that you got out of it, because that's reinforcing it and also returning your attention to what was discussed. So those can be some helpful strategies. This memory is a big one. So let's talk a little bit more about memory. There are typically, we think about memory in 3 different stages. The encoding stage, where we're trying to learn information and couple or pair that information with something that's salient to hold on to it. That's the cue that it needs to be stored. And so the storage happens, our brain will use the hippocampus to try to help store information. And to be able to hold on to that information is important and key, because we want to try to retrieve it. And the retrieval part is the end piece, that if we have found a way to help encode it properly, the retrieval should come a little bit easier. So we can have difficulties at any stage in this memory process. And for folks with Parkinson's disease, oftentimes it's the retrieval part that might be the most affected, that you might see the changes. The encoding and the storage tend to be okay, but the retrieval is often more difficult because it requires you to pull up the information on your own. You might need a recognition cue or clue to help you pull that information up. And we'll get into a little bit about some of those things that can help. It just might also take longer to learn new information. So you might need more repetition over time if you want to be able to learn it. And repetition, doing it just multiple times and allowing yourself that time. A lot of times people think, well, I should just be able to do this because I used to be able to learn something without any difficulty. Now it takes longer, and adjusting to that and giving yourself time and being kind with yourself if that's what's happening. Knowing that, yes, you can get the information in, we just might have to try some different ways to do that. So some examples of these cues and clues. I say multimodal just to mean that there are different ways to get information in. So for example, with Parkinson's disease, you might not want to use a lot of visual cues, because there might be some visual changes that affect somebody's ability to perceive some complex visual displays or to use the vision system as much as in the past. So you might want to use more tactile cues. So that means like things that will alert you, like a vibration perhaps that's got more of a touch sensation, a vibratory sensation that would alert you to do something if you want to remember it, or something auditory like an alarm that beeps. Somebody kind of giving you a keyword to help remember something. So those are some examples of the multiple different ways that we can use our senses and also help to couple that information to get it in. And it's important to try to keep things simple and not get too complex. Use of technology is okay if it makes our life easier or less frustrating. But it's important to realize that not all technology does this, and it could just cause more stress. And we don't want that. We want something to be able to stick. If it's going to be a cue or a clue, some sort of external aid to our memory, we want it to be easy to use and not frustrating, so that we can keep using it. So I have an example of that. I had a patient, he was in his late 60s, early 70s, really trying to manage his own business, still part-time, handyman business. And he was noticing changes in his processing speed, his ability to do things as rapidly and just take in as much information as he had in the past. And also his ability to kind of get to these multiple tasks. So it's more or less the multitasking, those executive functions. The organization was key. So he came in asking that's his goal, was to work on getting better organized. And I asked him to tell me a little bit about what he was already doing, the strategies he was using. And he said that, he found a calendar was what he was using. He just had so many things to do, it was hard to keep track. And so the next session, when I had him come in, I had him actually show me, what did that look like? What is this strategy, this calendar, and how are you applying it? And he came in with not one calendar, but 3 different calendars and 2 different smartphones. And I was very much surprised to see all of these things he was trying all at once. So I think he was searching for something, was trying to find the right fit for him, but in the end had just kept them all and was using them all at the same time. And so a great deal of the work that we did together was simplifying that system so that he didn't feel so pulled in so many different directions just by the calendar alone. The calendar was meant to be something that's simple and could, be in one place, not so many different places, and or something that could sync if you wanted it, but not to have so many different apps and locations and just separate things written separately. So that was part of the work we did together, and I finally got him down to one calendar and a couple different notes apps. But I think it was helpful over time, but it did take time. And so just to kind of let folks know that that's a process, and simplifying can often be the most important thing. All right, so I just want to do something a little interactive here, and we'll just do this together, meaning you don't have to type up any responses or anything like that. You can do it with yourself, and you don't have to share your responses with anybody else other than yourself. But let's practice. I'm going to have you try to focus and minimize distractions. And I'm going to give you just some words to listen to, and I'll put them on the screen as well. No taking notes, no writing them down. This is just for fun. And I'll show you the words briefly, and then I'm going to take them away and then see what you can remember. So here we go. Here is the list. We're going to the grocery store. We need to get toilet paper, popsicles, shaving cream, ice cream, ketchup, mustard, frozen pizza, relish, and soap. Okay, so take a moment. What can you remember? It's okay and normal if you don't recall everything or all of them that were on the list. But I want you to think, going into that, did you have a strategy? Was there any way that you could think of when that list was shown? How were you processing that information? And what would happen if you did have a strategy going into this? A way to organize the information. What about now with these categories shown? Does this jog your memory a little bit more? Does it make it a bit easier to pull up and recall those words that were on that grocery list? You'll see here it says chunking and categorizing. Well, chunking is an internal learning and memory strategy call it internal because it comes from ourselves. We've generated it ourselves. It's how our thinking process, we're trying to change that. And so it's an internally generated strategy versus something that's external, like a calendar or a written list, right? So this gets at how do we organize and add context to the material that we want to learn and remember so that it has more meaning. Repetition over time also helps. You can space out the repetition and retrieval to be briefer at first and then with a longer delay in between. So self-quizzing, kind of like we're doing right now. This is self-quizzing, but I could have given you 3 different times to learn that list. And guess what? You probably would have learned more each time. So that's where repetition and that self-quizzing in between can help. And the more context you give yourself, the more meaningful the information can become. And therefore, you'll likely be able to remember it more. You might still need a cue or a clue to jog your memory, but the likelihood of it sticking is greater if you're using some of these internal and external strategies. So let's see that list one more time. So if we did put the words into these different categories, it might seem a bit more doable now. And can you visualize yourself? Not only visualize, say, pictures of the items you're going to get, but maybe visualize yourself walking through the store, the grocery store, or going through the grocery store just to kind of grab some of these items, and how would you organize that piece? So, you know, this is something that we talk about. The visualizing piece is another way to add context, another way to add meaning. Another helpful strategy for both memory and organization is our calendars and planning. So I did talk a little bit about this already. You know, choosing the best format that works for you is important. Easier and simpler is often better and less frustrating. I have an example here of one calendar that's a full month that might require you to write really small and to highlight things, or, you know, it could get pretty complex and overwhelming if there's a lot that you're scheduling. Whereas the one next to it is 1 day per page. And that allows more room for color coding, adding more detail if you need, if there's a doctor's appointment and maybe you want to put the phone number for that doctor, so it's all handy right there. This display is simpler. It doesn't give you too many things all at once, and it helps you to better organize the material, the things that you need to remember. So writing down appointments, important events. Checking your calendar every morning can help, and at night, because as we talked about with that repetition, it can help then to just visualize it and to be able to repeat the information more, so it might stick. And then finding something that you can bring with you. So our mobile phones help with having some digital calendars that, you know, hopefully you can sync and just have one calendar. It can go from your device to your computer, maybe to a tablet that could be on display. So, you know, then you don't have to write anything multiple times or have multiple calendars, or even just low tech is fine too. Just having this 1 day a page calendar that you carry with you can also be helpful. You might want to set up automatic reminders that come up. You know, again, our cell phones, our mobile phones can do that. Automatic payments, so we don't have to think about them, but we can kind of visualize and see that they're coming up. And whenever you're planning something and putting something in your calendar, just try to go easy on yourself and give yourself enough time. So, you know, planning the preparation stage along with the doing of the task, and then maybe the afterwards where you're putting things away. So starting early, for example, if you have to clean a room or a garage, well, giving yourself that extra time to prepare, to actually do the task, to take breaks. Planning breaks in are important too. Sometimes we forget to do that, so you can put that in your calendar. And then, you know, trying to just do things that will prevent the frustration and the stress. because the last thing we want to do is make it so stressful that you never want to do it again. You want to be able to either enjoy the task or get through it. And if it's something that you found important that you want to do. So it's just to help reduce that frustration. A little bit more about executive functioning. With the planning and organization, we talked about how that's important and can be impacted, especially if our brain is fatigued, if we're, having our attention pulled in multiple different ways. And then, the frontal lobes of the brain are connected with many different pathways. And so the frontal lobes can help with executive functioning. They're often where we think about executive functioning coming from, but the pathways connect to other parts of the brain. And so with Parkinson's disease, it can impact executive function, but other areas of thinking that all interact. And so that's just to say that, reasoning through novel situations, making connections between an idea and a thought and applying it, sequencing from one thing to the next, these can all be impacted. So some other things aside from a calendar that can help are finding, just prioritizing and sticking to maybe 1, 2, or 3 important things that, are at the top of your list, and not going over more than that. Because what can happen is if we have so many complex things on that list, it might just get too overwhelming and again, make it harder to start tackling anything. For example, if you're going to cook a new recipe, you might need to break it into little parts and prioritize maybe the prep work first, getting the cooking tools together, the things you'll need, and then the actual, cooking, putting the ingredients together to make the dish, the timing of it, and knowing that you can use some tools to help with that as well. Another example might be finding a home for your commonly misplaced items. So a lot of people say, oh, I can't remember where I put my keys. I'm always losing my glasses, my readers. Where did I put my wallet or my phone? So these are, multiple things that maybe we just set down one place and then the next day it's set down in a different place. So finding a home for where these commonly misplaced items are, just one spot, like a bowl, it could be an organizer by the front door or the back door, wherever you can place them so that it becomes more of a routine. Instead of looking for all of them, they're there and you know to grab them and where to grab them. And it just takes out a little bit more of that guesswork that can be frustrating, and it makes it more of a routine. So then before you know it, it's less of a burden to have to remember where those items are. Going a little bit more into initiation, we can see that there's things that can really impact our ability to get enough energy to get up and go, to get started, especially if there's fatigue. That's part of the picture. You want to make a routine, and try to schedule tasks in your calendar so that it's more of an automatic thing. You're not having to just do something new and start over again. Giving yourself plenty of time can be helpful. And then asking somebody to help with either, making it rewarding when you start something, encouraging, providing some gentle cues, and maybe even just changing the environment or context if you need. So instead of doing something inside, maybe go outside to do it. Giving it a little bit more time so that you can warm up, and just rewarding yourself so that you might want to redo it again. Some more strategies here might be a diary or a log of notable symptoms, trying to find patterns of how they relate, the timing. Am I getting more tired and therefore forgetting more things at this time of the day? Is it happening when my medication is on versus when it's off? All of those things can be a piece of the picture. And then a memory book or a binder with information written down, color-coded, easy to find. I've often used that tool a lot with folks, and they found that really helpful taking pictures. If we have this device in our pocket, the phone that can now take pictures, it can help us to figure out, hey, where's the car? Where did I leave the car? Where is that new place, that new restaurant I wanted to go to with my, family, my friends? I just take a picture of the name of it, right? Or, an ingredient that we need to remember to put on the grocery list, taking a picture of it. So those pictures can be helpful as well. And again, a visual cue, a visual reminder may also be in addition to an auditory or a tactile, something we feel. And lastly, I want to go a little bit more into mood, and to say that, mood can also really impact our thinking skills. And so when we're thinking about ways to work around cognitive changes, we also want to look at, is depression or anxiety a part of the picture? Because they can both affect not only the type of mental energy, motivation that we have, but just in addition, pull at our attention. And so depression and anxiety can be even more common in people with Parkinson's disease than in other neurological conditions. And this likely has to do with the neurochemical changes happening in the brain and the overall adjustment to the changes in physical, cognitive functioning that happen that we can go through. And so there's this reduced production of dopamine, norepinephrine, serotonin in the brain. And these neurotransmitters are part of the pathways that help with mood regulation, motivation, and just emotional processing. So it's important not only to be aware of these symptoms, but also to talk to your doctor about them, because there are treatments. It might feel like it's not just adjusting to the changes, but the life changes in general that are thrown at us, and recognizing that there's a process in this, and feeling validated and being heard and understood that it's an ongoing adjustment. It's just not one and done. And also just sometimes it means finding ways to get unstuck if we're stuck in a situation. We might have this rigidity in thinking where we only see things one way. Well, having some creative solutions or others to help us to think about things in a different way can be helpful. And so I did talk about this already, as depression can be a normal reaction, but it just can be a part of the brain changes that happen with Parkinson's disease. And so this trial and this adjustment process can be a trial and error. The medications can sometimes help, sometimes they can be frustrating because there's more changes that need to be made. And medication cannot treat the condition 100%, or any medication in general cannot make the symptoms of Parkinson's go away, or the mood changes go away 100%, right? So we have to do things that get at it in multiple different ways. And so that's where trying to work with your doctors and therapy, sometimes that can also go a long way, in addition to the cognitive, the medication that can help with the symptoms of depression, anxiety, and mood changes. And going a little bit more into this cognitive rigidity, I just talked about, well, how do we get unstuck if we're feeling stuck? Some of the signs of stuckness might be just getting more angry than we used to, frustrated, overwhelmed. And this can be in relation to something that you wanted to accomplish that day and you couldn't do, or in the moment trying to remember something and it's not coming up. The right word isn't there, getting frustrated. And then that frustration can then circle into feeling even more stuck, because our brain is now focused on that piece. And so what can we do about that? We can practice a relaxation strategy, take some time to do some deep breathing, not only just deep breathing, but mindfulness, stretch breaks, also just ways to clear your head that work for you. Could be listening to music, have a brainstorming session with somebody who knows you well, and or who just can think outside of the box, right? That they can give you some creative solutions. And sometimes we don't even realize we're stuck on something. We might just overcommit to that one thing, and then at the cost of examining some other possibilities. And maybe even tapping into humor, creativity. I've heard of some improv groups, things that kind of help us to sort of see a different lens, see things through a different lens, and also challenge us to do things a little differently. So these are some ways, but I think also being connected, socially connected, social support can also go a long way. I touched upon the treatment options that can help. Therapy and medication together can be effective and helpful for emotional distress and just processing the changes, and help develop some coping strategies like seeking more information, shifting our approach to stress from one of over-focusing on it to maybe changing the interpretation, the thoughts, the things we say to ourselves, the statements we say to ourselves in the moments, like, oh, I forgot that one thing, this is horrible, now I've lost my memory forever. That's not helpful in the moment, because it gives a very much a sort of a look that there's nothing that can be changed. But often, as we know, with a little bit of time and a break, we know that may have just happened in that moment, and there are other ways to do things differently, and it doesn't signify that everything is forgotten. So just to say kind of, what am I saying to myself, and is it really true? Are there more helpful ways of looking at it? So instead of ruminating or blaming or shaming yourself, trying to give yourself a little bit of compassion. And have to mention, I would really be doing a disservice if I did not mention the benefits of exercise in the brain. It's shown to really be protective for cognition and good for the body. Exercise is something that is, each person may be able to do in a different way. So it's just something that gets you moving, that you enjoy, something that you can sustain for a period of time, and you'll want to keep doing in the long term. It could be yoga, chair yoga, Tai Chi. I've heard of rock steady boxing, which is really great for folks with Parkinson's, dance, stationary bike, walking, swimming, things that help not only just to develop the cardiovascular system and blood flow, but strength and stability, which can be really helpful if we're trying to avoid falls. And then what does it mean to do these activities we try to kind of find things that are enriching life experiences, things that you enjoy, that get you talking and thinking. That is brain stimulation. That's stimulating your neurons. Exercise does that. It helps us to sort of hopefully form some of these connections and ways that will help preserve thinking over time. Enriching activities do the same thing. We're building new connections, and it's helping to stimulate the brain. So all of these can help with quality of life, and also just in general trying to maintain function over time. Nutrition is key, eating a healthy diet, and trying to talk to your doctor if you think there are changes in your swallowing that might impact your nutrition or being able to eat healthy. Also, if you have a lot of medications and you want to start taking other things or changing your diet up, just ask your doctor before doing that abruptly. Same thing with exercise, but there usually are safe ways and good spots to kind of get started, some little changes that can make a big difference. And I know we're about time to finish up, so I'll just be finishing up here in the last bit here. We talked a bit about brain, like just quality of life in general, the things that physical activity can do for us. And the good news is that you can start at any time to get the benefits from a thinking side of things. So exercise can help us just to get, like I said, the blood flowing, but also to shore up a more mental energy. And so people who exercise and those who have done more aerobic exercise in some of the research studies have demonstrated that increased neuronal activity in certain parts of the brain, and that can be linked to just better learning and memory overall. So you can start at any time, and just trying to do those things that, like I said, you can kind of sustain and enjoy over time is key. What will stick? Lastly, the little piece about technology. You know, technology it depends, right? So if we want to use some more of these newfangled devices that are thrown at us, you know, apps, software, things that are being developed, you know, that are being talked about in the media, like a chip, a brain chip, right? You know, some things can help, but the temptation is to just go out and buy the latest thing without fully understanding or researching it. And there are strengths and weaknesses for each of these things. Media doesn't always help with that. So it's important to always be skeptical and to do a trial, just do your own little trial and do your own research if you can. Some examples of some potentially helpful technology could be a simple calendar that is on, say, one device and it syncs. It is something that you only have on one device, you make changes and it goes to the other device, like from your phone to your computer. A cooking machine that can help plan and store recipes. There are those out there that you can actually store all the recipes in it and you don't even have to think about the next steps. It walks you through one step to the next. So those are some examples. And or like a device that automatically turns off the lights at night, so, or dims the lights so that you don't have, your goal is to start to go to bed earlier or to do things that are less likely to impact your sleep in a negative way. That could be something from a technology standpoint that can make a difference. So those are just some examples. But the more important thing is to do things that are enriching for your brain, and to try to do things, if you're going to incorporate technology, just to make sure that it's not too overly complex and frustrating. And just anything that you try, you know, see if it's something that will stick for a period of time. And it's normal to go through a period of trying it and getting frustrated and adapting it so that it will work for you. For example, like a calendar, if it's just not helping, maybe we have to change where it's displayed or how it's displayed, or maybe it's not even a calendar, it's just a simple sheet that's on the counter each day. So each of those things can be adapted as we change and as as the disease process changes over time. So I just want to leave you with this last thought here. What strategies have you tried? And are they working, not working? How do you get them to stick? And what helps in general with your overall quality of life? So I hope I've given you some examples today, walked you through a little bit more about what thinking skill strategies might help. And if there's any other questions, I'll take them at the end.